Okay, so a little bit of a different setup. As you can see, I'm at a friend's house waiting on my car to be worked on around the corner here. So we'll be talking about Chapter 13, which covers antipsychotics and I think it is anti-anxiety. Just want to make sure I have the title right. Antipsychotic and anti-anxiety drugs. So this is a pretty interesting selection of medications and diseases. Um, Sometimes, well, a lot of times, well, I should say a lot of times with these medications, our mechanism of action will be unknown or it'll be spotty. We might have an idea how these drugs work, but they just work. And when it comes to someone having an issue with psychosis, we want to take care of that as quickly as possible for their quality of life and for the quality of their family's life, making it easier for everyone to take care of and deal with. So psychosis is a mental condition characterized by disturbed thought processes, delusions, and hallucinations. Antipsychotic drugs are used to suppress the symptoms of schizophrenia and other psychotic conditions. And the main site of antipsychotic drugs, the main site of action, is on the neuronal pathways involving the cerebral cortex and the limbic system. There are many different conditions that someone can suffer from. There's actually a whole manual dedicated just to psychotic conditions, which is called the DSM, and it's got different numbers now depending on what edition you're on. So again, this is a huge field of study. We're just going to kind of touch on a little bit of it. So the two neurotransmitters that are involved in psychotic behaviors are dopamine and serotonin. That doesn't mean they're bad. However, when they're out of balance, it can lead to these irrational, hallucinogenic behaviors. So antipsychotic drugs primarily antagonize dopamine and serotonin receptors. There are four classes of antipsychotic drugs: phenothiazines, butyrophenones, thioxanthines, and atypical antipsychotics, which have become a lot more popular in the past couple years. So, as you can see on slide 7, I'm going to make that a lot bigger there for a second. It's got the different receptors and where the medications act, the top being dopaminergic, the second being serotonergic, the third being cholinergic, and the fourth being adrenergic, last but not least histaminergic. So the two that we're concerned about there were the top two. That's where our antipsychotic drugs are going to act. For some reason it won't get smaller. There we go. So moving on from slide 7 onto slide 8, phenothiazines are first class of drug. These block dopamine and serotonin receptors. They reduce bizarre behavior of psychosis without depressing intellectual functions. The term phenothiazines refers to the basic chemical structure of a large number of drugs similar in structure and pharmacological action. So they block dopamine receptors to a greater degree than serotonin receptors. In addition to an antipsychotic effect, they also possess an anticholinergic, antihistaminic, alpha-adrenergic blocking, and antiemetic effect. So these drugs do a ton of stuff, which is why it had those pictures of the different receptors. Even though we're not talking about necessarily alpha-adrenergic or cholinergic receptors right now, you got to keep in mind these drugs have their side effects because they act on so many different receptors. So the main effects, again, are to reduce bizarre behavior of psychosis, as well as keep the patient at an intellectually functioning level, so not depressing them too much. Common adverse effects of these medications are usually from their cholinergic side effects: dry mouth, constipation, visual disturbances, and sedation, as well as antihistaminic effects. You've got a little bit of both in there. Alpha blocking actions may reduce blood pressure and cause postural hypotension. Dystonic reactions are characterized by muscle spasms, twitching, facial grimacing, and torticollis, which is a stiff neck. If you see the word in your book akathisia, it refers to body movement in which the individual is restless or constantly paces about. Parkinsonism involves the development of muscular rigidity, tremors, and other disturbances of movement. Tardive dyskinesia involves involuntary movement of the lips, jaw, tongue, and extremities. Neuroleptic malignant syndrome, which is very serious, is also associated with the use of antipsychotic drugs. This is characterized by hyperthermia, which is too high of a body temperature, muscular rigidity, catatonia, and autonomic nervous system instability. This is a very dangerous syndrome, and we want to try and prevent this as much as possible. So as you can see, there's a long list of side effects associated with these medications. Kind of scary, but most of the time, the benefits outweigh the cons. The patient gets better, and they may suffer some side effects, but their life is greatly improved. And they can become a functioning member of society again. Moving on to our next class of drugs, butyrophenones. They are high-potency drugs that, again, block dopamine more than serotonin receptors. If you see D2, that's your dopamine receptor. 5-HT2A is your serotonin receptor that we're talking about in this chapter. The butyrophenones produce a lower incidence of those nasty side effects that we were talking about, the alpha-adrenergic blockade, anticholinergic, and antihistaminic, so the patient won't be as dry or as tired. However, they have greater movement disturbances, that stuff we talked about, tardive dyskinesia, akathisia, etc. So this class of drugs is a little different than the phenothiazines. So our extrapyramidal symptoms are greater, our risk of neuroleptic malignant syndrome is greater, so again, monitoring with these drugs is increased. Our thioxanthines, they have chemical structures very similar to that of the phenothiazines. They also exert their antipsychotic effects by blocking dopamine receptors more than serotonin. It is associated with a higher incidence of extrapyramidal symptoms. However, it causes less sedation and fewer anticholinergic and alpha-blocking effects than those of chlorpromazine or phenothiazines. Our adverse effects usually include drowsiness, low blood pressure when going from sitting to standing, Parkinsonism symptoms, and extrapyramidal disturbances of movement. Let's see, anything else I want to tell you about those? No. Moving on to our atypical antipsychotics. This is the class of drugs you've seen talked about, Abilify, Seroquel, Geodon. These are the class of drugs that not only have those awesome commercials that tell you how much better they're going to make you, but they also have a lot of the nasty side effects, some weight gain, some other issues that go along with these medications. Unlike the phenothiazines, butyrophenones, and thioxanthines, the atypical antipsychotic drugs affect and reduce the activity of serotonin receptors more than they interfere with dopamine receptors. As with all antipsychotic drugs, there is a potential for development of EPS, extrapyramidal symptoms or syndrome, tardive dyskinesia, and neuroleptic malignant syndrome. They're also associated with several disturbances in metabolism, such as weight gain, elevated triglycerides, and development of diabetes. Our common drugs here, again, are Abilify, aripiprazole is the generic, Clozaril, which is clozapine for generic, Risperdal, generic is Risperidone, and Zyprexa, which the generic is olanzapine. I think they're missing a couple on there, but those are your major ones. Antipsychotics should not be used in pregnancy unless the benefits outweigh the risks. Many of the antipsychotic drugs, as we've already talked about, produce anticholinergic, alpha-blocking, antihistaminic, and central nervous system depressing effects. Therefore, these drugs will also interact with any of the other drugs that produce the same effects. So on slide 12, we have a list of your antipsychotics under the classes that we talked about. And it's got the potency, the level of sedation, the chance of extrapyramidal symptoms listed there as well. You don't have to memorize those, but it is a good idea just to familiarize yourself with the classes and the names. Moving on to slide 13. Anxiety. Anxiety is caused by uncertainty and situations that are interpreted as threatening or dangerous. The perceived dangers may be real or due to personal insecurities and unconscious psychological conflicts. When an anxiety condition is prolonged, there are significant behavioral and emotional changes. Anti-anxiety drugs, also referred to as anxiolytics, are used to calm individuals and reduce the unpleasant aspects of anxiety and hyperemotionalism. These drugs are kind of similar to ones you might see them used not only for anxiety but also for depression and sometimes for psychosis as well. The most common class that we use is benzodiazepines, and we've talked about these I think in the last chapter. These are your drugs that all sound, they end in PAM, clonazepam, diazepam, florazepam, temazepam. These are all your benzodiazepines, and they are controlled substances because they do have the risk of dependency on So they decrease the excitability and functional activity of specific areas of the brain and spinal cord. Excessive stimulation of the cerebral cortex can cause convulsions and other types of seizures. So when administered parenterally, benzodiazepines exert an anticonvulsant effect as well. So they are also used in seizures. Side effects of these medications include drowsiness, confusion, ataxia or movement difficulty, and minor GI disturbances. So these drugs can help patients feel relaxed without being overly sedated, which is a good thing. Again, it is a problem because patients can become dependent on them, which is why they are a controlled medication. There's also a problem with patients who have been taking these medications for a long time. If the drug is abruptly discontinued, they are tolerant and dependent on that medication physically and mentally. So if you take that drug away from them, you could put them into withdrawal. On slide 16, there's a list of benzodiazepines as well as their dose and their main use. Don't worry about the dose. Keep your eyes on the drug and their use. Last but not least, a random anti-anxiety drug, buspirone. It does not cause sedative, hypnotic, anticonvulsant, or skeletal muscle relaxant actions like the benzos do. However, it is a suitable alternative, especially when drug dependence and drug abuse problems are an issue. There are a few contraindications to its use. It is well tolerated, and I don't think there's a ton of side effects. So overall, a pretty good drug. So that covers chapter 13. We'll be moving on to chapter 14 in the next lecture, and I'll see you then.